Do you know that many patients at our clinic, they do call you the tallest, most cute, beautiful, black, brown type of hair doctor? For the stomach, is it possible to expand after bariatric surgery?
The other medication is vitamin support. This medication is not mandatory.
We also receive another questions that many patients, are very curious about, which comes to the part of the treatment part, like the medication part. So many patients wonder if it's a must after bariatric surgery for a patient to take vitamins for life and also minerals as well as medicines for the rest of their lives.
There is no mandatory for taking postoperative medications, but we really recommend some of medications. Let's talk about this. We prescribe the medications of stomach protectors. This is for stomach protection. It reduces the acid in the stomach, so it really helps the healing process. So we recommend stomach protectors for 3 months right after the surgery. But some of the surgeons don't prefer the stomach protectors, but our experience is the best when using the stomach protectors every day, nearly 30 minutes before the breakfast, we recommend. And the other medication is, right after the surgery, the patient may have the pain at the hotel. So the painkiller, the most least harmful medication to stomach, it's paracetamol, it's called Parol. If the patient has the pain, the patient can take the medication of paracetamol. It's not an obligation. When the patient has the pain, the patient uses the paracetamol. The other medication is vitamin support. This medication is not mandatory, as I mentioned before, especially in the restriction surgeries like sleeve. There is no malnutrition risk, there is no malabsorption risk. Maybe vitamin D or iron deficiency can be seen after the surgery, but it's because of the restricted diet. There is no malabsorption, no touch to intestines. So there is no mandatory, but we recommend for 2 months to take the vitamin pills. This is multivitamin support. It includes nearly every vitamin and mineral that you need. Every day, 1 pill. So for 2 months, they are using the vitamin support, and on the 3rd month we will see the blood test if there is vitamin or vitamin deficiency. If there is a deficiency in the 3rd month, you should continue the vitamin support, but if there is no deficiency of vitamin or minerals, you don't have to use the vitamin or minerals. That's all. The medications can continue after the surgery as a routine.
Okay.
I think this is the other most frequent question.
Yeah, if it's for
How
life.
can we use the routine medications that we use? You can use every medication, antihypertensive pills, vitamin or mineral supports. Also, we are giving the vitamin supports. Painkillers you can use, or neurologic disorders, neurologic medications, cardiac medications. You should continue, especially antidepressive medications. Right after the surgery, you should continue the antidepressive medications. There is no harms to stomach. Sometimes non-steroid anti-inflammatory drugs, this is the part of the anti-inflammatory drugs, painkiller drugs, it's not recommended to take the pills consecutively. You can use day by day, you can use the painkillers, but not in consecutive manner. For example, 5 days with consecutively, but you can take all of the medications. There is no restriction.
Okay, thank you. Perfect. And so now let's go after a patient has, lost weight within a year, for instance. For the stomach, is it possible to expand after bariatric surgery? And also in parallel, because many patients wonder if I can, can I regain weight after bariatric surgery? Is it possible?
Yeah, of course, there is a risk of expanded stomach. This is the nature of the stomach because it has so many muscle tissue. So it means it is expandable. Muscle tissue can expand after the surgery. Maybe not just right after the surgery, but after 6 months, maybe after 1 year. We can see the expanded stomach in the endoscopic follow-up, but as I mentioned before, it's a nature of the body. It's a nature of stomach tissue. It's a nature of muscle tissue, but it causes 20% unsuccessful weight loss after the surgery. The 80% of the patients have the success after the surgery.
And now bariatric surgery, you know, with everything that you've mentioned and you've talked about and you informed us as well, we do see that it's not something that can literally affect, right, a patient's life in a bad way, because it's here to help with the health and the weight loss process. But for some patients, especially women, whenever they see that, they wonder if in the future there are more like bigger consequences as far as getting pregnant, for instance. Is it possible after bariatric surgery for a woman to get pregnant?
We recommend the pregnancy 1 year after the surgery. The real cause is the diet. You are on a restricted diet right after the surgery, so it means there is a restriction of vitamin intake and mineral intake. So it can affect the baby, maybe not the patient, but during the pregnancy it can affect the baby in growth in the human body. So we recommend the pregnancy 1 year after the surgery. The patient have the fit body, everything is comfortable, like taking the diet, taking the healthier food. After 1 year, it is the best.
All right, Dr. Saeed, there is another question actually about the hair, because many patients, women, men, they wonder if after their bariatric surgery, they can observe hair fallout.
Yeah, this is the other most frequent question. We are following the patients for many years. Maybe after the 2nd year of the surgery, the patient can seek a help with the dietitian. So we always have a follow-up. We always have a database, and always the patients are questioned in the meaning of hair loss, in the context of vitamin and mineral deficiencies. So in our database, the patients have hair loss in 50% of the total patients. Generally, it starts in the 3rd month and it lasts in the 9th month. So 3 to 9 months after the surgery, the patients can experience a hair loss. The studies say the real matter, the real cause is not well known, but they concern about the hormonal imbalances after the surgery, because everything has changed after the surgery. There are hormonal changes, vitamin and mineral changes. Also, the body composition has changed after the surgery. So metabolism is changing, the diet is changing, everything has changed. So this is the real cause, maybe. We don't know this matter, but after 9 months, there is no hair loss problem. So it means there is a temporary problem.
Got you. Thank you very much for all, you know, the information you've given to us.
Thanks a lot.
And of course, many patients, they were wondering all of them, and you answered them pretty well and explained in details. Do you know that many patients at our clinic, they do call you the tallest, most cute, beautiful, black, brown type of hair doctor whenever they are looking for you? Where is that guy? The doctors, he's taller, he's younger, more fresher. Did you know that? Yeah, maybe we're gonna find a nickname for you. So whenever you come, we just comes up, the doctor himself and all that. So
yeah, maybe because of the difficulty of my name, maybe Dr. Saeed.
Yeah, some of them they can't.
Actually, it's the same with Said in English.
Said.
S-A-I-D.
Yes, Said. True. He said, yeah, true.
Yeah.
True.
It's a big honor and pleasure for me to be here. We are waiting for the other frequent questions.
Yes.
We want to answer the questions.
Yeah.
Thanks a lot.
Thank you very much, and do not hesitate, because our doctors are all here hearing your questions. If you have more questions, just write us, ask them to us, and our doctor will answer to you. Thank you very much. Bye-bye.
Bye-bye.